Glucagon administration. The school nurse, when available, is the most appropriate person in the school setting to provide care for a student with diabetes. However, many schools do not have full-time nurses. Even for schools that do, the nurse may not always be available during the school day, during school-sponsored extracurricular activities or field trips to assist with routine care and emergency care. Trained school personnel must be available to perform and assist the student with diabetes care tasks. This presentation is not intended to provide legal or healthcare advice. Please consult with a legal or healthcare professional regarding your specific questions or needs. Each training component was created specifically for school nurses and other qualified healthcare professionals to train school personnel. This unit is Glucagon. Participants will be able to understand what Glucagon is, how Glucagon should be stored, when Glucagon is used. Participants will be able to demonstrate how to administer Glucagon. Glucagon is a hormone that occurs naturally in the body. It is produced in the pancreas and raises blood glucose levels by causing the release of glycogen from the liver that raises blood glucose levels. Glucagon by injection is a life-saving prescription medication. It is given by injection and used to treat serious hypoglycemia. It was created for use by people who are not healthcare professionals. Many students may use a glucagon kit that requires reconstitution. However, there are ready-to-use kits that are increasingly available for student use. Glucagon by nasal powder is a life-saving prescription medication. It is also given needle-free by providing in the nostril where it is passively absorbed and used to treat serious hypoglycemia. It was created for use by people who are not in the healthcare professionals. If it is specified in the Student's Diabetes Medical Management Plan, or DMMP, Glucagon should be used when the student is unconscious, experiencing convulsions, or cannot eat or drink safely. Severe hypoglycemia can cause brain damage or death. While it may cause nausea and vomiting when the student regains consciousness, Glucagon is a life-saving treatment that cannot harm a student and cannot overdose. When included in the DMMP or physician's orders, the Glucagon kit should be accessible to trained school personnel and stored in a designated place, which may include keeping the kit with the student. Many students will have a kit that requires reconstitution, but other formulations now exist and are used when available. Newer formulations include Glucagon is a ready-to-use glucagon that is approved for 2 years of age and older. It is available in a HypoPen or pre-filled syringe. Baqsimi is a ready-to-use nasal powder form of glucagon that is approved for 4 years of age and older. The student's diabetes provider will determine glucagon based on the student's individual needs. Details for Glucagon should be outlined in the student's DMMP. Ready-to-use and nasal powder are a single dose and should not or cannot be reused. Any unused portion of Glucagon that requires reconstitution should be disposed within 1 hour. When included in the DMMP or physician's orders, the Glucagon kit should be accessible to trained school personnel and stored in a designated place, which may include keeping the kit with the student. Glucagon should be stored at room temperature. The expiration date should be checked before using. Do not administer if expired, discolored, or if requiring reconstitution does not dissolve well. Expired glucagon emergency kits can be used for future training sessions. Training demonstration kits are also available from kit manufacturers. When hypoglycemia is severe, the school nurse or trained diabetes personnel must respond immediately. Regardless of whether glucagon is to be given or not, emergency personnel should be summoned by calling 911 or emergency response personnel as soon as any of the following are exhibited: unconsciousness or unresponsiveness, convulsions or seizures or jerking movements, inability to safely eat or drink. If the student is having a seizure, is unconscious, or having difficulty swallowing, do not attempt to give food or drink or to put anything in his or her mouth because it could result in the students to choke. If possible, do a blood glucose check. Don't delay if a meter is not available and low blood glucose symptoms are being exhibited. If in doubt, always treat. Position student safely, being sure that the student is lying on his or her side in a clear, safe area protected from head and bodily injury. Do not leave the student alone. School nurse or other trained diabetes personnel should give glucagon as soon as possible after discovering that the student is unconscious or unable to swallow. A second person should call 911, then parent guardian, and school nurse as per the DMMP. Details for 3 methods of delivery will be discussed, but in addition to participating in this training, instructions inside the student's kit should be reviewed. This photo shows the inside of a glucagon emergency kit. This glucagon requires reconstitution and must be injected. Instructions are included in the package. Within this glucagon kit are a syringe pre-filled with a saline and a vial of powdered glucagon. Combine the glucagon for injection immediately before use by following the instructions that are included with the glucagon kit. Flip the plastic cap off the glass vial of the powdered glucagon. Remove the plastic cap off the syringe needle. Do not remove plastic clip from syringe as it prevents the rubber stopper from being pulled out. Put on gloves if available. Take the fluid-filled syringe in the glucagon emergency kit and inject the fluid into the bottle containing the glucagon powder. Shake gently or roll to mix until all the powder is dissolved and solution is clear. Inspect medication for color, clarity, and presence of lumps. Solution should be clear and colorless. Draw a prescribed amount of glucagon back into the syringe. Amount is per the student's DMMP. General guidelines are as follows. If the child weighs more than 45 pounds, inject the full vial of glucagon, 1 ml, using the buttocks, thigh, or arm. If the child weighs less than 45 pounds, inject half of the solution into the child's buttocks, thigh, or arm. Do not recap syringe. Discard sharp in the appropriate container. When possible, the injection site should be exposed and cleaned. However, glucagon can be administered without cleaning and through clothing if necessary. Injection is given at a 90-degree angle into the tissue under the cleansed area in an area such as the buttocks, thigh, or arm. This photo shows the inside of a glucagon foil pouch containing the Jivoke HypoPen made by one manufacturer. The pre-filled syringe is also found in a foiled pouch but will not be reviewed in these slides. Instructions for glucagon are always included on the package. The auto-injector or pre-filled syringe glucagon must be injected and are intended for subcutaneous tissue only. Open the package immediately before use by following the instructions that are included with the glucagon foil pouch. Tear open the pouch at the dotted line and carefully remove pen. Inspect the pen. Solution should be clear and colorless or a pale yellow. Pull the red needle cap straight off, choose a site, and expose bare skin. Do not administer ready to use through clothing and inject into fat tissue only, the lower abdomen, the outer thigh, or the outer arms. Use gloves and clean site if possible. Push and hold straight down against the injection site. Listen for a click. Continue to hold the device and count slowly to 5. Lift the device straight up. The yellow needle guard will lock over the needle. Carefully replace the red cap. This photo shows nasal glucagon. This nasal powder is currently only available in 1 dose and approved for those 4 years and older. Instructions for glucagon are always included on the package. The contents are passively absorbed in the nasal mucosa. The dose does not need to be inhaled. Open the package immediately before use by following the instructions that are included with the glucagon tube. Use gloves if possible. Hold device between fingers and thumb. Do not push plunger yet. Insert tip gently into one nostril until fingers touch the outside of the nose. Push plunger firmly all the way in. Dose is complete when the green line disappears. After providing glucagon, it's very important to monitor and provide additional management per the DMMP. It may take 10 to 20 minutes for the student to regain consciousness. Check blood sugar 15 to 20 minutes after administering glucagon. Give sips of regular soda or fruit juice once the student is awake and able to drink. Follow with concentrated sugar with snack containing proteins and carbohydrates such as peanut butter sandwich or cheese crackers to keep blood glucose levels elevated to normal levels and to prevent reoccurrence. Document blood glucose level and glucagon dosage as per the DMMP. If injection, do not recap syringe. Discard sharp in appropriate container. The time to complete recovery from a severe hypoglycemic episode varies according to how low the blood sugar level was and for how long prior to the treatment. Some signs and symptoms, such as headache, may persist for several hours, although the blood glucose level is satisfactory. The student may be unable to participate in learning or school activities up to several hours after a severe hypoglycemia episode. Continued monitoring is important, but is a challenge in the school setting. The student may need to be transported via EMS or sent home with the parent guardian. Don't be surprised if the student does not remember being unconscious, incoherent, or has a headache. Blood glucose becomes very high, over 200, or nausea and vomiting may occur.